Good evening, everyone. Welcome to DIKSHA e-learning. It's day 5 of the online certified program on clinical intervention on male and female infertility. We here at DIKSHA believe in the joy of sharing. So when these speakers come here and share their knowledge, it's really an asset to cherish for a lifetime. Till date, male infertility has been a topic that was discussed in the dark. But it's good to know that today male infertility is also important as female infertility, and it has been addressed, treated, and considered of great significance. With that being said, it's my great privilege to welcome Dr. A.S. Prashanth sir to this platform. Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For an uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your network connection first, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any suggestions or queries can be sent to the link provided in the both WhatsApp group and chat box. All queries raised in the link will be addressed at the end of the session. With that, it's my great pleasure to invite Sir to the stage. Now I would like to hand over the session to Sir. Over to you, Sir.
So good afternoon, everybody, Dr. Sudhir and team. So in the previous deliberations, at length we have gone through the concept of Shukra Dhatu, its Utpatti, and influence of Vata Dosha, how Panchamahabhuta and other factors are necessary for the production and growth of the Shukra Dhatu. Everything we have discussed with the basic concepts of Vajikarana. So let us go through the diagnosis of male infertility and issues like erectile dysfunction, etc. in this session. So, investigations. Many investigations need to be carried out in the infertility problem, especially the semenogram or semen analysis. That is for color, consistency, its volume. Of course, the consistency, volume, etc., may not have that clinical significance as per the Western system of medicine is concerned. But Ayurveda believes on that theory, especially when the Shukra Dhatu is getting dushita by different doshas. For example, Vatavarna Vedanam Vatena, Pittavarna Vedanam Pittena, Kleshmavarna Vedanam Kleshmana, Kunapakandi Anupamcha Raktena, Puti Puyanibam Shleshmatabhyam. Like that, Acharya Sushruta in the Sharirasthana well described how Shukradhatu is getting influenced by the doshic entities, Rakta, Purisha, Mutra, etc., different malas. And of course, when we speak about the quantity of the semen, that is especially the pramana, ardhanjaleha, as told in Ayurveda, here the average of 2 to 5 ml per ejaculum is considered. Of course, there are some population with anejoiculatory copulation. There are informations that retrograde ejaculation patients also do come to the outpatient section. And volume at that level. For example, when we do the prayog of the Shatavari is also called as Bahala, Bahalena Rasena. By the continuous usage and in the form of Rasayana or Shamanoshadi, especially Shatavari Kshirapaka, Sakandasita, Shatavari Kshirapaka, Sagrita Kandasita, is an excellent medicine for the increment of the Shukradhatu or the Pramana. So that investigations we have to look into, then we will find out the diagnosis. That is why it is said in the Shastra, Vikaranam akushalo na jihryat kadachana na kinchit vikaranam namato asti dhruvastitihi. Each and every condition come to the outpatient department cannot be labeled with the diagnosis. Sometimes the doshic diagnosis, doshic influence itself is enough for the treatment. Definitely, if that is made, many times our patient will go with a smiling face. Then
Excuse
erectile
me, sir.
dysfunction. Yeah.
Sorry, sir. Sir, can you on it in slideshow view?
1 minute.
Yes, sir.
In that erectile dysfunction, its clinical management, premature ejaculation, and their clinical management, etc., need to be discussed at length. So here comes the different conditions wherein the investigations is absolutely required. Hormonal regulation, hormone regulation in which the estradiol from brain and the testosterone content, then the aldosterone content, from where the luteinizing hormone, follicular stimulating hormone, etc. Then the tissues of the Sertoli level with the inhibition takes place. So hormone regulation is an important part in the infertility diagnosis. Sometimes Matrija Bhava, Matrija Bhava like estradiol content, if it is high, then of course the index of the infertility increases. Suppose if there is an increment at the level of the follicular stimulating hormone, then also the level of and influence incidence of the infertility goes high. Testosterone content reduction, hypotestosteronemia, on an average 5 to 10 mg of the testosterone content need to be released at the adulthoodness and in young adults. So there comes, if there is a testosterone deficiency, especially in hypogonadism and especially in conditions like hypoaldosteronism and leading to the possibility of hypotestosteronism, in which we believe the Pitraja Bhava, Pitraja Avayava, Matraja and Pitraja, out of which testosterone represents Pitraja Bhava, if that is deficient, in which hormonal deficiency causing various these problems. Then we have the concept of Vastandadi Prayoga in the Shastra. Vruddhi Samanehi Sarvesham Vipariter Vipareha. So Vruddhi Samanehi Sarvesham. Vruddhi of a dhatu, Vruddhi of a mala or a component, slide share. Vruddhi of a dhatu or an avayava getting increased by the influence, by the administration of Swayomuni Bhavagata Padarthas. Madam, now slides are available. Vruddhi Samanehi
Yes,
Sarvesham.
sir.
Yes?
Yes, sir. Yes, sir.
Yeah.
Thank you, sir.
Yes. Testosterone content. So very important factor. Estradiol content. Again, in some of the population with gynecomastia, because I remember a patient had come to me with the history of married life of several years, about 5 to 6 years, without any issues. And when he was thoroughly examined, his genital organs, especially the gonads, testicles, were of small size, and purposefully we did a clinical examination of the breast. There was gynecomastia. It was indicating definitely in this patient the FSH level is increased, estradiol content may be altered, testosterone content deficient. And earlier he had oligospermia, gradually progressive oligospermia, then turned into azoospermia, So we reversed totally this patient by giving, by by adopting the Vriddhi Samanaihi Sarvesham, by the prayer of the Vastanda Yoga. We'll discuss how to prepare the Vastanda Yoga, how to administer it, how many days it need to be given, etc. in the next session. Androgen deficiency in aging male is one of the areas where andropause now in Western countries, again, people are thinking regarding the andropause and different issues. About 3 decades before, if we've been asking them, what is the concept of andropause? No answer. Now, that particular branch is getting evolved and developing, nurtured. So, androgen deficiency in aging male is one of the areas. Serum testosterone content, in which the free levels of the testosterone need to be identified. Hypogonadal man, as discussed before, a patient with obesity, gynecomastia, whose FSH level is increased and testosterone content is reduced. Andropause like various problems in which I believe definitely the prostatic hypertrophies, prostatopathies, and areas like Alzheimer's disease also thought of. Why means in Alzheimer's disease there is a memory loss. In Alzheimer's disease, one will be unable to identify very nearest relative like spouse or children. Now whether there is a connectivity between andropause, Alzheimer's disease, tomorrow again a question will arise. I believe that definitely they should be interrelated, so that evaluation of the total serum content of the testosterone level and in secondary hypogonadism, luteinizing hormone also need to be done, of course, by the advanced technology, that is especially by the magnetic resonant imaging, imageology studies. We are able to find out the regions, growth of a tissue, an organ, testis, etc. They definitely help in the diagnosis. Being an Ayurveda practitioner, whether these hormone assays, they are definitely giving a light for the diagnosis and help for the treatment, we should think. I believe for the prognosis level, for the sadhya sadhyata, this should be the guideline, wherein Acharya Sushruta classifies several problems like asekya, narashanda, narishanda, irshaka, gudayoni, etc. Asekya will be having a very peculiar, abnormal sexual behavior, and yoni shefasayoho gandhamagraye labate shukam. Perverted and abnormal activity, sexual deviation should be there. In such a case, whether these hormonal assays are going to help, definitely we can say yes in some of the occasions. Irshaka, Narashanda, Narishanda, etc., different classifications. Also, we have to think, because Ayurveda believes definitely Atto Ninditi Adhyaya. My opinion says that Atto Ninditi Adhyaya is the basic guideline of metabolic and endocrine problems in Ayurveda. According to Ayurveda, the basics of endocrinology and metabolic disorder comes from the Atto Ninditya Prakarana. We'll get varied endocrine functions and they result into phenomena in the Atto Ninditya Prakarana as per Charaka. And if we study the Saulya Prakarana, again, why there is Krishna Vyavahita and why the Maithuna Asahyata is there, how an individual becomes infertile, etc. And this particular rule even applies for the female also. A female population with obesity comes with PCOD, comes with the tubal block. This particular obesity or the localized adiposity, Baddha Medas causing avaroda for the gati of Artava, and there will be delayed menstruation, in turn the irregular menstrual cycle causing increased body weight, and influence of the thyroid hormones, especially the hypothyroidism nowadays, These are all in toto disturbing the patient so that some of the conditions go from kashtasadhya to asadhya avastha also. Can we reverse it? If not possible, we can convince the patient what the next step is and how he should go Staulyapakarshana Chikitsa, how Patya Paripalana should be employed, and how various other prayogas like Vasti Udvartana should be helpful. In that way, the guidelines, depending upon the weight reduction, and if this particular woman gets her cycle very regular instead of the irregular cycles, then the index of the fertility level goes high. After 1 or few years, again she will come. Yes, doctor, definitely your medicines and therapy has been giving me results. So now I am pregnant. Like that. So this lifestyle modification and treatment of plan of Santarpunata Vikara, that is Apatarpana Chikitsa, Medo Apakarshana Chikitsa, and the treatment schedule mentioned, though in the Ashtoniditya, many of these prakaranas are told as asadhya, we can make an attempt, though it is asadhya, convince the patient with by attempting different treatment schedules. So there are some idiopathic causes also. Idiopathic causes also, and hypothalamic pituitary disorders, idiopathic isolated gonadotropic deficiency, Kalman syndrome. This Kalman syndrome is such a condition usually seen in both females and males. Single gene mutations. Acharya Charaka describes Bija, Bijavaga, Bijavagavaya. I usually say that why Sharirasthan of the Charaka Samhita has been neglected. There are much informations by Charaka in the Atulya Gotriya, Purusha Vichaya Sharira, etc., where the tail, body, head, probably the genetic codes, chromosomal factors, etc., are discussed at length. Further, the commentary also speaks about that. In Charaka Samhita, we come across one of the very important area, Asapinda cha ya nari, Asatulya cha yo naraha. Pinda and Gotra. Pinda means from Matra, 3 generations. From mother, 3 generations. And from father, it is Gotra, as per Charaka, 7 generations. Don't have a physical relationship or marriage, should be arranged. So if the marriage is arranged, there are some problems. So genetic mutations. Then hypothyroidism followed by hypothalamic and pituitary tumors, infertility diseases. I had a case in which the prolactin content was very high. Hyperprolactinemia was there. A female without any pregnancy, she was getting this. And sometimes with the patients of parathyroid hormone imbalance, there are possibilities of getting hyperprolactinemia. Then some of the drugs, they induce hypogonadal disease, especially during cancer therapy, therapy of the leukemia. Some of the critical illness we see in chronic liver disease, in alcoholic liver disease, gynecomastia, erectile dysfunction, hypogonadism, they are seen. And some chronic systemic illness like obesity, atistolya, Vagbata classifies stolya into 2, stula and atistula. Atistulastya beshajam. He told only atistula is not good for treatment, but stula can be treated well. So there is that we have to go through the commentaries and critically evaluate the patient and come to a conclusion, diagnose him and help him. Followed by infections. So in primary gonadal disorders, Klinefelter syndrome is one of the area in which the X and Y chromosomes, they are varied, X, Y chromosome, and single gene mutations followed by cryptorchidism. So in which the undescended testes followed by microarchaea will be there, and at the level of the inguinal ring or before that, it is getting undescended, unable to produce the sperm bodies, varicocele. Yes, nowadays we are getting n number of patients with varicocele. Varicocele of the lower extremities, gradually in ascending order, they go to the pampiniform plexus, And just like a worn bag appearance on palpation by the visual examination, we appreciate the varicocele. I believe Shukravega Avarodha is one of the concepts. Acharya Charak and Vagbhata are very clear. Vegavarodha is not at all good. Vegavarodha leading to manifestation of many clinical issues, and Shukra Vega Avarodha causing various these issues and Vitama Marma Abhigata, etc. So dosha the Marma Abhigata, I believe, therein the varicoceles and dilatation of the pampiniform plexus. It can be well examined and appreciated clinically with bimanual examination, and palpate the area, and there will be hardening of the vessels of that area. Then infection, especially the mumps and orchitis. In the last lecture regarding mumps and orchitis, we have cleared the parotid glands. They are having a cynar group of cells. That means honeycomb-like appearance. Again, the pancreatic tissues also honeycomb-like. The ovaries also, they resemble like honeycomb appearance. Testicles also, their tissues are arranged just like a honeycomb. Then there is a similarity in the tissues from the parotid to testis. If there is any Karnamula Shofagata Jwara, followed by mumps or parotitis, a viral fever, and it is a Sukhasatyavadi, easily reversible. But sometimes a patient without his knowledge at the childhood gets testicular pain after taking some amount of chikitsa like Tribuna Kirti or Hinguleshwara Rasa, or at least some Amradottara Kashaya, etc., he should be alright. After several years of his life, when he is married, he will be detected as a case of azoospermia or severe progressive oligospermia. In such a case, infection history is very important, and there we need to ask the parents of that particular patient whether your son had any history of parotitis in his childhood, whether he had any history of severe pain and followed by pyrexal attacks with the severe body ache, angamarta, myalgia, etc. Then she will say yes. During when he was in 7th standard, he had this problem. So some of the drugs, radiation, gonadotoxins, and chronic illness. So drugs in the sense mainly the anti-cancer drugs, followed by some of the anti-hypertensive drugs also found to be causing the toxicity, but they are removed from the market, and once for all they are not available. And gonadotoxins, some of the agents, they induce the toxicity to the testicles. I believe whether Kshara can be given for a prolonged period. In the Charaka Vimana, he says, Pippali Lavanam Ksharam, not Tipa Injita. Kshara Prayoga, that is, any Tishna Kshara for a prolonged period is not good. Kshara Pumso Paghata Karana. Whether this particular Kshara, which is given for a longer period, causing any effect, any problem, and any Shukradhat involvement or Shukra Kshaya is noticed, we can say, and further studies are required in this regard. So, since in Vimanasthana, Charaka explains all these issues, we advise many Ksharas in Gulmaroga. We do the Kshara Sutra therapy in Arshobhagandhara. Whether they are harmful, usually we say it is no. But we have to evaluate and do the follow-up to the patients, find out whether any erectile dysfunction, any issues are there related to his genital functions and gonads. Chronic illness, especially the hepatomegaly, chronic liver illness, hepatitis B infestations, we have been seeing that. So patient will be having erectile dysfunction followed by hypogonadary functions. So the diagnosis, hormonal say, are most important part in the clinical evaluation. There are some areas where the patient comes with epididymal obstruction. The epididymis is getting srotorodha. There is avarodha called dysfunction. Now, if there is a srotorodha, what is the treatment? Usually, it is a congenital defect. Can we rectify it? Definitely, we have to think about the prayer of the Shilajitu. Shilajitu is the master remedy, and Shilajitu is Rasayana, Shilajitu is also Vrishya. Shilajitu kalpas are widely practiced in Ayurveda, and some research should taken place by the prayer of the Shilajitu kalpa, Gomutra Gandhi Shilajitu in the epididymal obstruction, and dysfunction. As well, I believe Sahachara and Sahachara Prabheda, Burlaria priorities, including the Syreka, should be the correct drug for these kind of dysfunction and varicosity of that area. Hypospadias, in which the developmental anomaly will be there, defect will be there, there will be infections, and sometimes a patient underwent vasectomy will be coming after a few years. Doctor, can you help me? Of course, again in modern science, that particular aspect is well developed. They do the reconstruction surgeries, herniorrhaphies, especially the inguinal hernia and scrotal hernia. So, if the hernial mass or the intestinal loops which are escaped from the abdominal wall or through the inguinal ring will be causing severe frictions and current continuous friction over the genital organ and especially over the testicles. And because of the rub between the intestinal smooth muscles and testicles, the spermocidal activity, spermatogenetic activity, spermatocidal activity will be there, spermatogenetic activity is suppressed, and this may lead to Vandhyata or the Purusha Vandhyata, what we call the infertility, or patient may get azoospermic issues also. Carter-Jenner syndrome, in which a patient comes with the bidirectional shunt with a mirror image of shift of his cardia, and he will be suffering from sinusitis, he will be suffering from severe bronchitis, and also sometimes due to the breathlessness. I had one more history. A patient was referred from Manipal, from Kasturba Medical College, Manipal, where patient died on the almost by the third day of married life because of the massive MI. The reason was he had a severe COPD, and because of breathlessness and maybe during the copulation, etc., some amount of Ayasana Shwasa was there, Shramajanya Shwasa was there, increased with Klama and Glani produced the myocardial infarction, probably, I believe. So, Carter-Jenner syndrome, young syndrome, of course, young syndrome or young syndrome is again in the young adults, it is seen with the severe hormonal deficiency and ejaculatory dysfunction. Ejaculatory dysfunction in the sense the retrograde ejaculation. So here, for the retrograde ejaculation and anejaculatory copulation, for the anejaculatory copulation, as discussed before, definitely the Brahati Phala Prayoga, Brahati Phala Kshirapaka has helped in few patients. I had one patient from the State Bank of India, another, an old lady, a grandma brought her grandson with a history of all these different issues, and both of these cases were were successful. And the first one, the State Bank of India, he had later, after about 12 to 15 years of married life, first issue after the Brahati Phala Prayoga, and second twins in a period of 2 years, and having a very, very, very happy family life. Whereas the other lady who brought her grandson, is also very happy with an offspring. Likewise, all retrograde ejaculation and anejaculatory copulation may not be asadhya if thoroughly examined, and if confidence can be brought. That's why Harshana Ashwasana Chikissa has been told in Shukravrata and Shukrakatavata. Harshana Ashwasana. What is this Harshana? Praharsha yono samuddista yogaha shatamuddista mevacha. Charaka in the Chikasasana Vajikarana Pada says that Praharsha yono, and you have to see that a person gets, both male and female population gets orgasm. Praharsha yono samuddista yoga shatamuddista mevacha. Hundreds of yogas I am explaining, Acharacharaka is explaining, because they should be helpful for every cause. Like that, permutations and combinations of Rasabheda Vikalpa and Guna Vikalpa Nyaya, if applied in the pharmacopoeia, definitely patients will be getting response. In that way, hypothalamic pituitary disorders, in which Kalman syndrome, as we have discussed earlier, is a condition where sensory neuronal hearing loss. By birth itself, the person is unable to hear. That is why Maithuna is a karma. Sexual activity is a particular area in which I believe Pancha Karmendriya, Ubhayatmaka Manas is totally involved. Kalman syndrome is such an example wherein sensory neuronal hearing loss, speech center followed by the motor and sensory speech area is not developed properly. And red-green blindness will be there. Chakshu viparya, there will be andhyata. Anosmia, grana viparya, grana nasha. Cleft palate. So in such a condition, followed by renal anomalies, so there will be the gonadotrophin releasing hormone is deficient, hypothalamo pituitary deficiency will be there, inactivity will be there, and we can call this patient as asadhya. So asadhya, because for prognosis, I believe today's investigations may be a guideline. We can't get result in each and every case. If there is any other, definitely any other margas, any upayas, or any plans, we can tell our patient. Usually, these population with infertility, they will believe the doctor as a god. And once if they step into the clinic, they are happy. And we'll have to make them happy. They will believe us for everything. Ultimately, at least for adaptation also, we may have to convince them. So in such a way, Kalman syndrome and gonadotrophin releasing hormone deficiency becomes irreversible because it is sahaja. Klinefelter syndrome. So here, this population, I had a few cases. Ajanubah, their extremities are elongated, their fingers are lengthy, just like acromegale, and long arms and long legs. Whereas if the testicles are examined, they are small sized, crypt orchidism, followed by a level of the luteinizing hormone, follicular stimulating hormone is increased, testosterone content is reduced, psychological anomalies will be there, abnormalities. They are depressed. I am unable to produce a child. And of course, all masculine characters also will be absent in some cases, I observed. Followed by some of the chest infections are common, like recurrent bronchitis, and they may land up with some tumors and cancers too. I believe again Klinefelter syndrome is also irreversible because Acharya Charakai Nashtaniditya discusses every aspect, and it should be the alone and perfect guideline as per Ayurveda for metabolic and endocrine issues. If we go through the aloma, atiloma, followed by atidirga, atihrisva, atikrishna, atigaura, atistula, mixed up, if we make it mix all these findings, then many of these hormonal and endocrine issues comes there. There are some primary gonadal disorders. Primary gonadal disorders, in a sense, Y-chrome deletions. 20% of the men report with infertility. Some of them land up in oligospermia and azoospermia. And of course, genetic counseling is very much required. Of course, this is the task of the Western system of medicine and infertility practitioners. Of course, the sperm concentration is also reduced in primary gonadal disorders. Can we help these patients? If there is hypogonadism without any chromosomal defect, definitely our Vastandadi Prayoga should be the master remedy. Yogaratnakara, Vaishidhyaratnavalikara, Acharya Vagbhata, many authors discusses this Bastanda Yoga, and in our practice, we have cultivated, we have developed the practice of Prayoga of Bastanda Yoga, Sakritam, Tilan, Bastanda Jaha, and he will be able to get the proper erection, maintain the erection, followed by the sperm concentration also gradually increased. Probably what sample size research is required in this regard. Failure of the testicular descent, in which at the level of the inguinal ring itself, it is being situated. In the previous deliberation, we have discussed A female, due to her education today, she was able to identify her husband, recently married, doesn't have any testicles. Into the scrotal sac, they are not descended. They came to us. Then, when the ultrasonography was done, there was microarchaea and undescended testes, etc. Gulmama Chikissa, Prayog of the Eranda Sneha, different Eranda Kalpas, Eranda Sukumara, etc. are wonderful. Erandam Brishyam Vataharana and Vriddhi Bradna Hrudroga, especially Vriddhi and Bradna Vat Chikissa, in which the descent of the testis can be seen. So again, a vast sample size research in this regard is appreciated. FSH level is raised. Follicular stimulating hormone level is raised in this population. Luteinizing hormone is normal, and they may develop tumors also, like cancer. And varicosity of the pampiniform plexus. What happens here? I definitely again stress upon Shukra Vega Avarodha. And maybe in Keli Kutuhala, of course, in various granthas like Charaka Sushra, the different granthas, why regarding Hastamaituna, why regarding the masturbation, much informations are not available and why it is missing. And maybe the informations are available in the form of Ayonigaman, etc., Shukravega Dharana, etc. But in Keli Kutuhala and Anangaranga, like various recent texts, there's a discussion of masturbation. I believe definitely masturbation should be one of the reasons. And we have analyzed the history of some of the population. To have an enjoyment for a prolonged period, what the male population do is they practice masturbation, they suppress the ejaculation, again undergo for masturbation, they suppress it, they go on repeating it. To have a prolonged activity and have an enthusiasm, a level of what you call ananda karma by the upasthendriya, they may do it. That in turn has caused into dilatation of the pampiniform plexus, especially the varicose veins, just like an worm bag appearance. I believe definitely the Ballataka Prayoga, Ballataka Avaleha, and a Prayog of Sahachara, Prayog of Shilajitu must help the patient along with Vasti Karma, because there is a Srotoroda and we may help the patient in grade 1 and grade 2, maybe grade 4, etc. At that level, it may be irreversible. And many patients undergoing cancer therapy with radiation, and when they are exposed to radiation, a patient had come to us. He was working in a bakery wherein to the tandoori rotis preparation, and this particular furnace Agni, what we call, it is almost at the level of the Nabi and Vamshana Pradesh. He is continuously exposed for that, and he had severe oligospermia and landed into azoospermia because the temperature was influencing. So in that way, the history taking is very important. Radiation again gives a lot of temperature that will burn or suppress the spermatogenetic activity and leading to severe suppression of the testicular glands. Epididymal dysfunctions. It may be intrauterine exposure, usually some of the drugs, toxic drugs causing this. Some of the patients they develop congenital bilateral absence of vas deferens. Congenital bilateral absence of the vas deferens. By birth itself, it is vas deferens, Shukravas, Utansi, spermatic cord, they are missing, and cartilage syndrome with severe recurrent cyanotic infection, bronchiectasis, followed by male infertility. So there, the transport disorders, sperm transport disorders, Shukra Janana will be there and they are arrested. Maturation arrest will be there. They are not transported to the anterior part of the vulvar part of the urethra. And at the level of the, soon after the anterior part of the prostate gland, they are not getting ejaculated into the penile part of the urethra. So that if there is any avarodha, can Ayurveda help? So we have to think definitely Vasti Karma, Virechana Karma. But if it is a congenital one, we may not be able to get that results. However, an attempt can be made in this regard. When we look into the genetic causes of the male infertility, out of which the Klinefelter syndrome, on an average, 5% of the patient comes to us. Y chrome involvement is 10%. Congenital mass difference absentia, about again 5% comes. So we have to evaluate thoroughly and find out whether the patient is Narishanda, Asekya, Udayoni, Irshaka, or any other type of Klaibya Prakarna mentioned in Charaka Samhita, wherein he explains the Jabanga, the different vikaras, erectile dysfunctions, etc. And in Yoni Vapat also he discusses a beautiful Prakarna called Arajaska Yoni Vapat, wherein a female population comes without any menstruation and she has not attained any feminine characters. Likewise, we have to at length discuss, evaluate when a patient comes with history taking and physical examination, investigation parts are very important. Nowadays, patient comes with a big file. Doctor, soon after he enters into the outpatient section, he will keep the file on the table. Doctor, you please go through it. Okay, how many hospitals have been roaming around? Almost this is the 15th hospital. Good. Okay, let us talk each other. Aturasya antaratmanam na vishati tattvavit. We have to discuss at length with the patient. We have to listen to him carefully because depression, lack of confidence has brought him without any hopes. And after that, we have to study for what purpose he has come. Can we help him? So these hormonal areas are a very difficult task for an Ayurveda clinician. Of course, when it comes to the Shukra Pravartana, or when it comes to the motility issue, when it comes to the pH value, when it comes to the Tanutva, or it is the Dhani Bhutatva, the Kafadosha, etc. So our science has got an upper hand in treating. On an average, I believe herbal system of medicine, herbo-mineral system of practice, different karmas like Vasti and Virechana karma. Why Vasti and Virechana? Mainly Apanavata, Apano Apanagha, and Apanam Sarvatra Anulomaya. Apanavata need to be doing its regulatory function. And once if the Apana Anulomana is made, Shukra Pravartana, Artha Nishkramana, and Garbhodpadana Samarthya, everything can be successful. With that way, we have to believe the Siddhanta properly and select the drugs from Yoniyapat Prakarana, Vajikarana Dhyaya, as well as from other sources and recent texts like Vaishya Ratnavadi, Yoga Ratnakara, and a very recent one like Vasyayana Kama Sutra also. So in Vasyayana Kama Sutra also, why? I believe till the period of Chandragupta II, sex medicine was not nurtured. Only in Ashtanga Ayurveda it is said, and much informations were missing. But when during the period of Chandragupta II onwards, some of the compendiums and Shastra Granthas were brought into practice and society, in which Vasyayana Kama Sutra 1 is one. So he has developed many Mukadaurgandhanashika yogas, wherein the marital conflicts comes. He developed many yogas for Tajabanga. He developed Shukadosha Prakarana and many applications for the genital region, Sthana Gaudikarana yogas. Probably by that time, population were started coming and getting encouraged, attracted by this particular branch. Of course, the male infertility and its evaluation need to be done systematically. In which, what are the goals? Specific cause, you have to correct it. You have to identify the cause and correct it. Followed by whether the patient is fit for artificial reproduction therapy and IUI, the gynecologist or attending clinician need to decide it. Whether the genetic abnormality what the parent is having is going to influence over the child, offspring, etc. And underlying medical condition need to be thought. And when pregnancy fails to occur after 1 year of the regular unprotected intercourse, the evaluation should be properly made, thorough examination, help of the modern gadgets, Help of the modern gadgets in the sense, once they are available, that science we are using for our diagnosis and maybe as a guideline, as a tool of guideline. Earlier evaluation of the men for any other obvious infertility factor, because usually in olden days, before decades, only female population have been cursed, Adivandya, Kakavandya, etc. But after the advancement of science, after the clinical medicine has nurtured and evolved and developed, there is equal role of the male partner also. And a stress factor like different issues, many pharmacological preparations, alcohol, tobacco, etc., are found to be toxic as well. They are leading to infertility. They have been identified. So, in that way, history taking part, clinical examination should be thoroughly made. Patient should be very happy. No doctor has examined at length before, and you are the alone doctor. So, pronouns for you. He should be able to express it. And you have to ask what is the duration of infertility, and whether there was any miscarriage, whether there was a stillbirth, etc. One couple had come to me from Dharwad, there's a district headquarters. Very first child was dead. Soon after birth was dead. Why? Because there was some cardiac anomaly according to the parents' information. Again, second pregnancy she had. The same thing happened. Soon after labor, child died. Then both of them were admitted at our hospital setup. And for the male partner, Snehapana followed by Virechana, followed by Shukra Shodhana, Mahakashaya Charakokta, Ela Valuka Sahita was given almost for a period of 3 months, was under observation, repeated follow-up. Female population also, the partner was also underwent Snehapana followed by Virechana and Vasti. Prajastapana Kashaya Charakokta was administered to her, and we did a very good follow-up. Every 15 days patient has to report, and fortunately the patient was a very good follower of Ayurveda. By the end of a few months, she conceived. And what we did is, we consulted a ultrasonography specialist and a cardiologist. What they told is, we will do one thing. We will do the fetal echocardiogram, and we will find out which trimester there is a defect. We will also guide you, and also we will let you know regarding the intrauterine weight, etc. Wonderful. Fetal weight, its vertex, etc. All 3 trimesters went very smoothly without any abnormality, and we had a still phobia. And that doctor came to us. She called me, doctor, on the day of labor, I'll be attending in that nursing home. I'll see whether the child have any amount of abnormality, cardiac abnormality, etc. He told. So he did accordingly. Being a modern clinician, MD, DM cardio, with the help of pediatrician, he attended soon after labor, examined the child at length and in detail, and he gave a feedback, child is perfect, all right. This I am telling. And they had a lot of belief on the Deva also, Deva Pasha Chikis also, they underwent all prayer, etc. And the child now going to the school. Later they had one more child with the same principle of management. So here, thorough evaluation, thorough examination is definitely required. And a person who lost the hopes went with a smiling face with the 2 children now. So that duration of infertility, previous infertility histories, fertility history, coital frequencies are also very, very, very important. The patient is having premature ejaculation, there also is going to be address the thing here. Sexual dysfunction, especially erectile dysfunction and flaccid genital organ, history of previous evaluation, etc. Childhood illnesses, any trauma, any marma abhigata, pitapa marma abhigata, any kokundra marma abhigata, and so on. Previous surgical issues like herniorrhaphy, hernioplasty, repairs, and any chronic medical illnesses, sexually transmitted diseases. Now the big brother came to the forefront field. With that big brother, HIV/AIDS. Before HIV/AIDS, almost for 5 decades, medical world, their bread and butter were dependent upon the sexually transmitted infections and illnesses disorders like syphilis, gonorrhea, and short sore, chancroid, etc. So sexually transmitted disease, there will be possibility of orchitis, possibility of getting ascending rectal infections, urinary tract infections, prostatic infections. All these together may lead into severe suppression of the spermatogenesis. So history of sexually transmitted disease need to be considered. Hutchinson's teeth sometimes a child will develop, hunched nose sometimes in leprosy they develop. So all these histories are very important. History too, history of exposure to the gonorrheal toxins, medications and allergies. Many antihypertensive drugs, they are found to be occupation and addictions. Especially, I told you, people working in uh, area with the high atomic energy, thermal power plants, bakeries, they are cooks. Their testicle region, their pelvic region is overexposed to the temperature. As well, the medications and addictions, alcohol addiction, tobacco addiction, maybe gutka in future coming days. We have to evaluate whether there is any role because these gutka achievers they land up with the erectile dysfunction. No doctor per day I consume about 15-20 gutka cheats, and nowadays I got loss of libido. This is the answer from them. Can you evaluate? So yatha marjarah tamakum na munchati tatacha vyasani tavakum na tijati. It is told in the Shastra that yatha marjarah is cat. Cat will not leave rat because cat and rats they are both natural enemies. What happens here? Today's marjara, today's cat is very weak, today's rat is very strong, and you will be seeing big sized rats. If there is a quarrel happens between those, again rat will win. Like that, tatata vyasani tamakum natyati. Tam akum, aku is tambaku, tam akum, aku is rat. So, vyasana, addictions need to be evaluated properly. De-addiction therapy should be encouraged, and we will need to try to help both partners in this regard. The physical examination of the penile region, sometimes during birth only, a child will be having the opening of the urethra, that is the inferior aspect, just after the just above the level of the scrotum. Then the spermatic ducts are not properly getting opened. There are after two changes. Location of the urethral meatus, very important. Palpation of the testis and size. Definitely, this is going to give very good diagnosis and idea. Presence and consistency of vas and epidermis. We have to examine it. We have to carefully palpate it and identify. Sometimes lymph node enlargement. Pelvic lymph node enlargement will be appreciable. And in pelvic inflammatory diseases, in problems like sexually transmitted diseases, patient is having a lymphadenopathy, and they will again go on infecting the urethral system and the genitourinary system. Secondary sexual characters, thoroughly we have to again examine whether this particular man is having feminine voice, whether any that will give a guidelines regarding the hormone assay and the consistency of the hairs, breast development. Digital rectal examination also one of the guidelines, especially in prostatomegaly and other issues, we will come to know. And level of the vas difference, whether it is opened or not, a surgeon can appreciate by DRE exams. Semen analysis. After the thorough clinical examination, the hormone assay, though the system is entirely from the Western system, Ayurvedic interpretation are essentially need to be done and thought of. So semen analysis, collection after a defined period of abstinence for 2 to 3 days. I believe in some of the infertility patients and the severe oligospermia, absentia or abstinence, absentia from sex, absentia from copulation, abstinence for a prolonged period is very much required. Not 2 to 3 days, it is not enough. I just compare this and tell our patients that suppose if there is a borewell and only the borewell can give water to only 1 or 2 houses in the colony. If you want to give almost to the 100 houses, it is not possible. Similarly, if there is a deficiency, Shukradhatukshaya, if there is a oligospermia, progressive oligospermia, if the abstinence is made for few number of days, Shukradhatu Utpadana, its pravartana and its collection will be definitely helpful. We have discussed this with the expert infertility specialists. They are also agreeing, yes, we have to change our things, the thinking level, and if that guidelines is incorporated, patients will be benefited. That way, absentia from sexual copulation or abstinence for a week, it will give a very good sample. It is my opinion. Semen may be collected in a clean container, definitely a sterile container, and of course there are condoms have been developed. Samples should be examined within an hour of collection, and if there are some abnormalities, it should be repeated within 4 weeks. So many times another problem patient faces. When this male individual is sent to the laboratory, situation of the laboratory and situation of the toilet, bathrooms, very dirty, and their smell. See, doctor, I had no erection after I had been for a masturbation attempt. I could not do it. This is the answer from them. Can I collect it from my home and take it? So then what we have to do? We have to make arrangements for a technician. By that time, soon after the sample is collected, he should collect and go to the laboratory. That way it can be advised, and within the particular time duration, it should be examined. So this way, semen analysis, its collection method should be thoroughly made, and the thinking level of 2 to 3 days, it should be changed as per my opinion. And few patients, many patients of oligospermia and progressive oligospermia, they have been very much happy, and when the partner is conceived by this method, keeping them from the sexual copulation away for a prolonged number of days will be helping to them, and counting the ovulation day, monitoring it, follicular, that is the follicular rupture should be analyzed properly. In that way, the guidance is given to them. After a few months, they will come with a sweet box. Doctor, your advice has been given a wonderful change to us. So there are methods of centrifugation. In the centrifugal machine, it could be kept and rotated, and supernatant area should be, the layer should be removed, pallet should be examined. This way, now semen banks have been getting developed. Of course, again, in Ayurveda, whether we have any such establishments, we will say no. But still, for Vajikarana Shastra, by the help of modern gadgets and research methodology application, has been further developing, and to the mankind, they are very, very, very useful and applicable. When we go to the normal reference range, volume should be below 5 ml or average. And of course, in Shukra Shara Purusha, it may be higher also, because Ayurveda believes this particular Shastra and Siddhanta. pH value on an average is 7.2. Viscosity, 3, the viscosity scale is between 0 to 4. Sperm concentration about 20 million. Total sperm number about 40 million per ejaculate. Percentage of motility, average 50% should be motile. Therefore, the good pregnancy, forward progression should be there. Normal morphology should be identified. Round cells about around 5 million, and agglutation also should be looked at. In that way, semenogram as per WHO guidelines and as per the infertility practitioners and specialists. Some of the lower ranges also need to be thought of. Oleum around 1.5 ml is also fine. Sperm concentration about 15 ml is also okay. Total sperm number about 39 million or around 40 million. Motility about 40%. Progressive motility around 32%. Normal morphology around 4%. And vitality, viability about 58%. So that the prognostic value can be decided, and what is the level of the treatment, for how many days, how many months the treatment should be carried out, we can make a judgment regarding these. And when we examine the pH value, generally it should be alkaline, and it is having fructose content. In sexually transmitted diseases, in retrograde ejaculation patients, it becomes acidic. Male seminal discharge is alkaline in nature. Female cervical mucosa, vaginal mucosa is acidic in nature. So nature is balancing it. In chronic sinusitis, in candidal infections, the pH value of the localized area in female population varies. That is why your Prakshalna yogas like Panchavalkalakpata Prakshalna, Triflakpata Prakshalna, some of the Pichi yogas, they are wonderfully giving response to our set of patients. Similarly, for a male patient, when it is acidic, our Brahatyadi Kashaya, our Veerataradi Kashaya, our Vastyamaya Grita, and many other yogas like Gokshradi Gukulu, they are giving a beautiful response to our patients. And being Pitta Lakshanas, acidic response is seen. Again, Virechana. We encourage Virechana and Vasti to the maximum number of infertility patients. Maybe one is carried very rarely. Maybe in some centers, I've been seeing that they conduct even Vamana also. But in our practice, we limit to Virechana and Vasti because the Adhonabi Gata Vata, Shukravata Vata, Shukra Gata Vata, that concept, Apanam Sarvatra Anunomaya. That should be the belief here. Azoospermia, so in which there is a complete absence of sperm. Complete absence of sperm. We have seen some patients, progressive oligospermia, progressive, landing into azoospermia. This is also happening. During the first visit, 20 million, second visit, 18 million, coming to 10 million, and one after a few months, 0. This is also happening. I believe if that is the case, many a times it is reversible and reversible. They respond very well for our Swarnabhasma Prayoga and for our combination like Trivanga, etc. Vangasya Bhakshanat Supnepi Na Jayate Shukrakshaya. Very beautifully wrote in the Shastra, Swarnamangadi, Yoga, etc. And for azoospermia, I have to again find out whether there is any obstructive changes or whether the patient is having any other causes, etc. Oligospermia is a finding wherein below 20 million is the average count, and the volume and concentration also need to be examined. Motility factor. So regarding the oligospermia, always Ayurveda treatment gives an upper. Few cases of azoospermia that I am telling, progressive oligospermia followed with azoospermia. Many times it is reversible. We have evidence also. Whereas motility factor, again, Ayurveda treatment response is wonderful here, especially when we give Sargunatmaka Dravya like Eranda, Gandharva Haritaka Prayoga, Nimamrata Eranda Prayoga, etc. Eranda Sara, Chalaguna is getting hampered here. We have to increase the Chalatva, and Shaliparni, Prishniparni Sadhita Kshira Yoga is also applicable here. Shukrashodhana Mahakashaya. So like that, more than the Kartaushadi, it is Khanija Dravya Prayoga, found to be very, very effective in the motility factor environment. Further, we have to see they should be progressively motile. In some of the conditions with astenospermia, poor sperm motility. Is poor sperm motility indicating anti-sperm antibodies. Again, for anti-sperm antibodies, virechana karma and shodhana chikitsa, vastu chikitsa. For genital tract infection, again, shodhana chikitsa. For retrograde ejaculation, for varicocele, there should be the answer. So in that way, the treatment should be planned and procured. So motility count, total motile count and vitality. So here, whether the sperm is viable or non-viable, cartilaginous syndrome, but think of vitality test we have to make, normal sperm count, low sperm count, normal sperm, abnormal sperm, normal forward propagation of progression, and abnormal motility. So, Bijabhagaveva, Shukra Janaka, Pravartaka, Shukra Sutikara, Buddhikara. Wonderful concepts in our Shastra. And these yogas are helpful in many issues, many problems. We can address them. But always think about whether the patient is facing any genetic, any endocrine issues, then up to the Pratyake Vidhi, it may go. Teratospermia, in which 70% of the spermatozoa is abnormal. Usually in grade 4 varicocele, in primary and secondary testicular failure, it is observed. Necrospermia, Ayurveda describes all these different areas. Puti Puyanibham, Kunapagandhi cha. So it is necrotic and putrefied order, pus cells will be there. So we can reverse some of the cases by giving Khanija Dravya Prayoga, by giving Vasti, especially Apanavasti, Raja Apanavasti, and many times, again, Eranda Kalpana need to be encouraged. Sukumar Grita, like yoga has to be given. Phala Grita. Phala Grita is advised for both male and female. Phala Grita is Phaladhayaka, Shipra Phaladhayaka. So it should be given in the form of Opedika Sneha. It can be given Siddhasnehi Vidana, Arohana, according to the need and availability. And Punarapi Vishodhaye. Such cases need to undergo Vishodhana Karma Punarapi repeated. There are certain specialized tests also. Number one, penetration into the oocyte. Very recent advancement says that release of some of the enzymes like acrosomal enzymes, zona pellucida level at the level of testicles, autoantibodies. Again, recently the science says that autoantibody liberations, sperm penetration assay, yes, computer assisted sperm analysis, more advanced electronic microscopic examinations. One of our pathologists has been helping us in severe oligospermia patients. He will examine the semen sample under the electronic microscope and give the feedback. And by give treatment, how they are responding, again electronic exam, the microscopic examination. In that way, we can take the help of our modern colleagues, Western colleagues, and when they look into the results, yes, they have been doing wonderful, they say. Acrosomal reactions, some of the biochemical tests, and DNA test, etc. Endocrine evaluation already we have discussed, like abnormal semen analysis, sexual dysfunctions, and specific endocrinopathies from the pituitary to testicular glands. Always follicular-stimulating hormone need to be evaluated, total testosterone content, luteinizing hormone, prolactin content, and TSH level, estradiol level, etc. Depending upon the severity, involvement, but study and how far we can help our patient to think. A table says that FSH level, LH level, and free testosterone content with the hypogonadotropic hypogonadism, abnormal spermatogenesis, testicular failure need to be assessed properly. Physical examination, as discussed before, transrectal USG, transrectal USG for duct obstruction, Shukrava Sroto Avaroda, transscrotal ultrasonography for varicocele, presence of cyst, tumors, etc. Renal scan in Young's disease, Young syndrome, in Kalman syndrome, testicular biopsies for azoospermia, and vasograms for varicosity, for pampering for plexus dilatation, and any vascular Doppler studies for penile blood flow. In Dojamanga, due to penile dysfunction, erectile dysfunction, secondary to vascular origin, sometimes there is a calcification. We had a patient, he had a very severe calcification of the blood vessels or the penile blood vessels, and how to help him. So we have identified the cause, underlying cause, and later some of the Mardana yogas. Of course, collateral circulation is very important in this regard. The Y chromosome deletions, that is, genetic evaluation is very important. Chromosomal abnormalities, anomalies, and chronic duct obstruction evaluation should be made. So this way, abnormal semen analysis to be thought of, discussed, and evaluated. Semen analysis, its collection time, its procedure, following the all aseptic precautions, macroscopic and microscopic examination. Ayurveda even believes regarding the macroscopic examination, as discussed before, its varna, its consistency, tanutva, stigdatva, pichinatva, its smell, etc. Microscopic, of course, have to do the examination. Computer assisted semen analysis. So high precision quantitative assessment of the sperm kinematics, whether it is motile, progressive motile, how much is motile. So likewise, we have to examine, decide it by the help of the computer assisted semen analysis. It will give a data regarding the sperm density, motility, straight line and curvilinear velocity. Yes, average path velocity, how much quick it is, amplitude of lateral head displacement, etc. So hyperactivation. So semen analysis thoroughly should be carried out, and Ayurveda can help in this regard by the prayog of the Masha, Kapikachu, maybe the other kalpas like Ashwagandha, Valeha, Bastanda Yoga at this level. Some of the specific investigations: anti-sperm antibody test, hypoosmotic swelling test, sperm penetration into the oocyte. Post-coital test is also done in some cases. Post-orgasmic urine analysis, chromosomal and genetic studies. So in detail, if this is done and already done, it may give a tool for its prognosis, diagnosis, what can be done, and whether at our setup it is possible or patient requires further management and guidance, so we can help the patient in this regard. Imaging studies. So scrotal ultrasonography, ultrasound scan, especially for the varicocele, undescended testes, orchitis, hypogonadism, so many issues. And transrectal ultrasound scan, in which excellent definition of the prostate, seminal vesicles, ampulla, ejaculatory duct, etc. are examined. And these imaging studies, they are the advanced studies. By that, clinically, we can appreciate the changes, whether they say testicular swelling, varicocele, dilated veins in spermatic cord, any lymph nodes or any calcifications, so many problems. You can identify hydrocele, so many things. So hydrocele, long-standing hydrocele linked infertility. Spermicidal activity will be there. And as already discussed, the herniations, total hernia, very dangerous. Testicular ultrasonography, again, will give you an idea regarding the testicular mass, seminoma, granthi, etc. Testicular biopsy. Now, everything is over. Sometimes testicular biopsy will give a guide regarding the obstructive and non-obstructive things. It will also give regarding the health of the Shukra Dharakala, tunica vaginalis, whether the tunica albuginea, like area, are healthy, they're able to produce the spermatozoa. In that way, testicular biopsy also give certain ideas. So erectile dysfunction. So after the thorough examination, taking the modern gadgets into consideration, definitely an Ayurveda practitioner can help our patients, because this is the generation where people go to many hospitals and come back to us. Last hope is Ayush system of medicine. We are helpless, but when they come to us, at least we should be able to help them. Erectile dysfunction is a consistent inability to achieve or maintain penile erection sufficiently for a satisfactory sexual act. Ayurveda describes Makara Dhwaja. Why Makara? Crocodile. Crocodile swimming in the water with its tail erected. In that way, Makara Dhwaja. Nakraretaha Shukravardhanana. Charaka says. Of course, all those things are beyond our imagination. However, the Dhwaja, regarding Dhwaja, erected penile organ, erected genital organ is considered. And a person is unable to maintain it up to his level of satisfaction. It is utmost importance to understand the underlying etiology. What is the cause here? Whether there is a vascular cause, whether there is an endocrine cause, whether there is a neuropathic cause, or whether there is a psychological issue, depression, nowadays depression, stress, depression or stress management is very important in sexual health, and lot of separations in the marital life, lot of legal issues in the courts are pending regarding erectile dysfunction and its management, and sattva chikitsa, counseling, ashvasana chikitsa. You have to encourage them, you have to build up the confidence. Both of the partners should be thoroughly explained these factors, and if they are having hopelessness, we have to address the problem and help them. Physiology of the ejaculation, in which there will be an adequate sensory stimulation, especially the glans penis and the penile nerve is getting hyperactivated. There will be posterior urethral distension. Cremasteric muscles will be gradually elevated, and testicles are getting ejected up, evaluated up, and in that way elevated up. So that will maintain the ejaculatory response. Moreover, the sinus, cavernous sinus, the penile sinus is known for heavy blood flow, especially during ejaculation, during erection. So that has to be, blood pump has to be thought of. And whether Ayurveda can help in the Prakarana of the Dvajabhanga, Klaibya, because Ayurveda says one lifestyle management here. Nidrayattam sukam sukam pushtik karsha balabalam prashata karshata jivam ajnanam jivitasya. Prashata klaibyata. Prashatva and klaibyata depend upon nidra. If he is jagaruka, always getting the disturbed sleep, always doing the night duty, then he will be losing his fertility index. He You may go for Claybia, Dojabanga. Likewise, Jarajanya Claybia, Marmabhigatajanya Claybia, Manasika Claybia, Doshaja Claybia. So many fields are discussed. Only another problem, it should have been told in the Vajikarana Prakarana. But we are getting the Yonivapat Prakarana and so on. Maybe when the Shastra was written, there was a kind of a question and answer session. Student was asking the teacher, and teacher was answering whenever the doubt comes. That way the Shastra was written in the same way it is presented. So the pictogram gives us an idea. During the erection of the genital organ, how the corpus area is having high blood flow, and how the testis is getting gradually elevated due to the cremasteric reflex. Corpus cavernosum is getting filled up with blood. How a flaccid genital region appears with a limited blood flow. And during the normal process of ejaculation, when they are created in the testis, traverse through the vas deferens into the seminal vesicles, opening at the end of the urethra, prostate fluids also getting injected up, and at the level of the penile tip, it is getting ejaculated. In that way, a pictogram has been very beautifully given and is the known factor. However, when a patient comes, this is our exercise. The information what we are having will be helping us. Anxiety. Yes, generalized anxiety syndrome and anxiety disorders. Anxious, always anxious. So, Vataladhya Sadaturaha, Sukshma Chalavata Prakriti, known for premature ejaculation and erection is not maintained. Anxiety. You have to ask them, the couple, what time you go to the bed? They'll tell 11 o'clock in the night. What time you get up? 6 o'clock. No, do one thing. 1 hour before only you go to the bed and 1 hour late you get up. Nothing is going to happen. You are early morning train, you are not moving. You be together and have confidence, have a very mutual consent, understanding, love, affection. So in anxiety, depression. Depression due to several, all office stress is brought house. But as you get the patient, whatever your office material, leave it at office only. When you step into the home, you should not have any such suppressive activities. Relationship and understanding problems. So this is the great area. A patient was telling me, my wife, she's PhD, MSc. She's a professor in a college. I'm just a diploma holder. There is a lot of misunderstanding because of the education qualification and earning. No. When you are planning for a copulation, planning for an issue, all those things should be forgotten. So relationship problem, both should be addressed and educated properly. Psychiatric disorders, schizophrenia, depression, etc. Even epilepsy, psychoneurological issue. Spinal cord injuries and trauma, especially in lumbar canal stenosis, spina bifida, as well as some injuries and accidents, fractures, multiple sclerosis, ascending and descending tract is getting disturbed, diabetic neuropathy, supti swapa aharshana claybia is pelvic surgeries, especially the prostate surgeries, bladder, neck surgeries, and so on. Parkinson's disease, because the Parkinson's, that's why Kapikachu becomes a beautiful drug in Parkinson's. Kapikachu or Vanara becomes a very beautiful drug in infertility. There is a relationship. Moreover, I told you regarding the Alzheimer's problem also. Probably we have to study at length this area. Parkinson's disease, One more issue is that Kapikachu is given with Ushnodaka there. Along with hot water, Kapikachu action is good. Whereas if it is for Shukradhatavardhana, Kshira should be the good Anupana. Or Madhu should be the Anupana. Like that, Anupana Vaishishtya also should be thought of. So here the extrapyramidal tract involvement with the disturbance in the nervostriatal area and a lot of musculoskeletal involvement is observed. Atherosclerosis and atheroma of the penile blood vessels, calcifications. Alcohol and drug abuse. Of course, Ayurveda describes Ayuktyuktam Yuktaya Yuktyktam Yathamritam. Prathama Madhavastha is very good for sexual activity and copulation. When it goes to the third and fourth stage, it is going to disturb the sexual function. There will be sexual dysfunction. Chronic alcoholism leading to gynecomastia, liver disorders, ascites, and totally sexual function is lost. So alcohol, drug abuse, and antihypertensive drugs with pedal edema, antipsychotic drugs, prostate cancers. So on an average, these are the reasons for ED and diabetic individuals, hypertensive individuals, obesity population, Cushing syndrome, high lipid values, followed by some of the hyperthyroidism problems. In hyperthyroidism, we'll get all the pitta lakshanas. Pittasya svedadaha, raga ushmapakitaha. Likewise. Whereas in hypothyroidism, all kapha nada vikara like aswapna, arochaka, tripti, tandra, gaurava, nidralutva, shofa, etc. Acromegaly, again the pituitary gland is hyperactivated, cortisone content, hypogonadism. So as per the practice of infertility, so the various areas how one will get ED. Ayurveda says that Vardhakya Jara is one of the causes, and Ayurveda says that Jarajanya, Manasikajanya, Vyadikarshita, sometimes due to disease, Marmopadhamsa, Abhighata, Doshaja, and so on conditions. So here, ignorance, if the patient is having any psychological issue like ignorance, ignoring the wife, or she is ignoring the partner, fear of failure and performance anxiety, whether I am able to perform today's night, if the night comes and near the bedroom, why the night comes? Few couples say, why I don't know, doctor, why the night comes. Night should not come. It should be day only. So that I will be working in the kitchen. I will be cleaning my house. Why it comes? So failure, fear, performance anxiety. Psychiatric disorders. Dhat syndrome. So regarding Dhat syndrome, in the South India, Southern Asia, SAARC countries, this is one major area where along with urine, they say that spermatoria happens, nocturnal emission happens, why that weakness comes, fatigueness, chronic fatigue syndrome, klama, daurbalya, glani, alasya, sukha swapna prasangitvam, dukkha doshana lolata, shaktasya chapi anusaha, karmasu alasya muchyate. That way patient is getting alasya lakshanas and glani, klama. Anayasa jashramo dehu prabuddha shwasavarjitaha saklama iti vijneha indriyartha prabhavaka. Fear of pregnancy, sometimes avoiding the pregnancy, let me conceive later, let the partner conceive later, and that phobia. Sometimes we get another set of population. During ovulation period, there is severe erectile dysfunction. Rest of the period, he is the king. Likewise, we have to have the counseling. They have to have the very beautiful mutual consent, understanding, love, etc. So Shukra is known for Dhairya, Chavana, Preeti. Environmental factors, lack of privacy in joint house setting. The Indian society is a great area again. One patient was telling, doctor, the problem is that, see, now I am married. I am thinking that what my parents will think. I am thinking that what my younger brother will think if I close the doors and be with my wife. So if such feelings they are there, you'll be helpless. So you have to educate them and guide them properly. Yes, environmental factors. One patient was telling me, doctor, our cot, the lots of sound is created when we lie down. During movement, lots of sound is vibration is created, and we stay in the upstairs. What people in the downstairs will think of? Ayo, you forget, yeah, or nobody will think anything. All these are the natural phenomena. So gradually, harshana, ashwasana, chikissa, and satwaja chikissa, and sometimes it's drug induced also. So arteriogenic ED, blood flow should be maintained properly. If there is any leaking, as well as sometimes hemorrhage, trauma causing this, neurogenic in alcoholic neuropathy, diabetic neuropathy, Parkinson's disease, in spina bifida issues, in conditions like the lumbar canal stenosis and so on. Endocrinological EDs like already developed, discussed hirsutism, hypogonadism, psychogenic and drug induced. Performance anxiety. Performance anxiety. Can I, whether I am in a position to satisfy my partner, whether I can perform well, phobia. Ayurveda says Vajikarana Mitra Mandali. Vajikarana Mitra Mandali, one should share his knowledge, his experience with the colleagues. But sometimes there will be an adverse reaction also. His close friend will say that my sexual functionality, my sexual behavior, sexuality is wonderful. I perform like anything. And this fellow keep it that in the mind and comes to his partner and whether I am able to do that, perform it. Performance anxiety, relationship problems. So here we have to believe the role of Udana Vayu, Prana Vayu, Vyana and Apana. Relationship problem, and once again, forceful marriages and some suspicious activities, doubtful, unnecessary doubts, and extramarital affairs. During lockdown period, an incident happened. So husband used to be always on traveling, of course having one child. And during lockdown period, he could not move. Now also it's lockdown period again. And he used to go to the upstairs, giving biscuit to the dogs frequently. And wife was doubtful. She went along with him and saw that he's sitting near the dog, giving biscuit, no doubt, looking into the mobile, chatting with the girlfriend. So relationship issue started, rift and friction, fighting started, problems with intimacy, again, the age problem, generation problem, depressions, guilty consciousness. Guilty consciousness. I am not looking good. Whether husband will be accepting me, whether wife will be accepting me. All those issues. Psychological trauma in homosexuality and heterosexuality, the rapes and the other issues. Trauma. And hearing some traumatic incidences. Yes, this has happened to my relative. Should not happen with me. And this sexuality, sexual behavior, it's a bad thing. No. Previous sexual abuse and sadism. We had another set of patients. This fellow, by cigarettes, he used to burn wife's body here and there, and giving, by that pain he was enjoying. Sadist. Giving some trauma, hit to her. So, these kind of abnormal behaviors leading to a great failure in their sexual life. Shukra Gata Mahata, as discussed several times, Shukram Munchati Badnat Shukram Garba Matapiva Vikritim Jane Chapi Shukrasthat Pito Anilaha. Shukram Munchati Badnati. Premature ejaculation, Badnati, no ejaculation, retrograde ejaculation or duct obstruction. Sometimes she may get pregnant. Garba Matapiva Vikritim Jane Chapi. embryological abnormalities, intrauterine life, growth issues, Shukrastha Kuptonila. Apravritti, Ratipravrittirva, Vikrita Shukrage. Sometimes there is apravritti, atipravritti, always discharge, lack of control. Shukrasya Shikram Sargam Sangam Vikriti Mevacha Tadgarbasya Shukrastha Siraso Admana Riktite. So, Shukra Gata Vata, Vata dosha, Chalaguna, and Vata dosha Viparya, causing all these various problems. And our patient who had two children, two neonates, immediately after labor died, was managed with Shukra Gata Vata Vat. And of course, Prajastana Varga, Gana Kashaya of Charaka is that great. We have prepared Grita Yogas, Shira Yogas, Churna Yogas out of Prajastapana Mahakashaya. And I believe Putran Jivaka Roxburgi, Putra Jivaka is also that wonderful drug. And Shukravrta Vata, Shukra Vego, Ativego, Shukra Avega, Ativega, Nishpalatvam to Shukrage. So there will be Nishpalatva. No any issues, no any pregnancies can take place. How to manage? Nigdam Vantam Viriktam Cha Nirudham Anuvasitam. Snehana, Snehapana, Snehevasti, Pidaka Sneha Vidhana. Pantam Viriktam, of course, better it is always Virechana. Nirudham Anuvasitam. Yapanavasti. Yapanavasti, always. And Yoje Chukra Doshartam, Samyak Uttarabasthina. Uttarabasti. Yes. During Uttarabasti, some problems we face. One is recurrent infection of the genital tract. And by using the indwelling Follis 18 catheter, Uttarabasti can be even much helpful. Intra-bladder and intra-vesicular administration of Kshira Yogas, etc. Praharsho Annapanam cha. The Dravya should be stimulant. Praharshana. Enjoy, should become enthusiastic. Shali, Goduma, Kushmanda, Masha, Praharsho Annapanam cha. Shukraste Bala Shukra Karam Hitam. Bala Atibala, Bala Rasayana, Nagabala Rasayana. Shukra Karam Hitam, Shavahavari Prayoga. Vibadda Margam, Dushtva Shukram Dadyal Virechana. And Virechana, always Erandas Virechana, Mrudu Virechana, Samshodhana Karma is that beneficial in these areas. Natistigda Shariraya, Dadyat Sneha Virechanam, Neotkista Shariraya, Ruksham Dadyat Virechanam. Eranda Taila, Eranda Sukumara, Gandharva Eranda, Nimamrita Eranda, Nirgundi Eranda, Gandharva Sadi Taila, Hingut Triguna Taila. All Erandas and Hingut Triguna Taila, Gurmachikisa, Atanumana, Admanahara, Atopahara, and Ado Vatasirode, Gulmoda, Tarukla, Vatamutra Shakasam. So, Vega, Virodina, Udavarata, Nutriguna Taila is very effective. And Ningut Triguna Vasti is practiced. In the erectile dysfunction, some Shamanoshids like Akar Karabadivati containing even Anacyclus pyrethrum, beautiful drug, Ukras Thambe, Akar Karabaha, Jati Falaha, Jati Kosha Phalam Tata. And that is containing Ahifen also, but getting Ahifena Kalpana in the market having lots of legal problems and ethical issues. Vanari Gutika, again, most beautiful, and we have done clinical trials on that area. Sarna Basma, definitely in oligostenospermia, severe oligospermia, Swarna and Vanga. Nagavalyaji Churna, Uttejaka, Kamottejaka, Shukra Vallabarasa. Kamini Vidramana Rasa. Why the name Kamini Vidramana? Is the female orgasm is improved. Equally, the opposite sex partner is satisfied. And Bharat Vangeshwar Rasa, Vasanta Kusmakar Rasa in diabetic neuropathy, in Parkinson's disease, alcoholic neuropathy, and neurogenic ED is going to help. So, we have to treat the erectile dysfunction with the Sthanika yogas. There are some Sthanika yogas, local applications. Linga Ghadikarana yoga, Linga Vardhana Tailam, Linga Vardhana Taila, Shogandha Yamaka. Its Sthanika Abhyanga massage should be performed proper. We have tried Varahavasa, Shukaravasa. Wonderful it is. Very much effective. So it will strengthen the genital area, penile organ. So its Abhyanga should be carried out because it is highly Brahmana, highly Brahmana, Dhatuvardhaka, Sri Gopala Taila, etc. So by the period of Vatsyayana, by the period of Anangaranga, Keli Kutuhala, etc. We get lots of the informations regarding all these local applications for the Vankshana Pradesha, Navi Pradesha, Sthana Pradesha, Yoni Pradesha, and so on. So, premature ejaculation is also another area wherein there is a persistent or recurrent ejaculation with minimal stimulation before. So, partner is not at all satisfied and happy. It is during the act of copulation or shortly after penetration and before the person wishes it, over which the sufferer has little or no voluntary control, which causes lot of sufferings and distress. So PME, so in young adults, this is a very, very routine complaint. In drug addicts, very routine. People with anxiety, depression, again the problem, premature ejaculation. So, the maintenance of the erectile penis, genital organ, is not possible. So, it is considered as the complaint if the patient is ejaculated within 30 seconds after the vaginal penetration. So, several definitions there. Shukra Meha Prakarana in the Pramehadikara, Shukra Mutra Prakarana in Mutra Kachra Prakarana. After that, it comes Shukravarta Vata, Shukragata Vata. So, various areas we come across the reference and findings of the premature ejaculation Shastra. Chalaguna Vriddhi of Vayu will be there. Always for Chalaguna Vriddhi of Vayu, Sthiraguna Pradhana Ahara Dravyas are very important. That's why Masha, Godhuma Payasa, or Grahi Dravya, Grahi Stambhaka, Dipanam, Pachanam Chayeva, Yadushtatva, Dravasho Shukrit, Grahi Tatcha. So, Jati Phala is that important one. Narcotics. That is why hyphen was widely used. Nowadays, getting hyphen is problematic. It is called as Krishna. Krishna is black. The black market name has come from hyphena prayoga. Black drug is marketed without any knowledge, without anybody's information. Blackly, that is theftfully one is selling it. Krishna, Krishna Digutika, hyphena, Shukra Vallabharasa, and so on. So in premature ejaculation, lifelong P will be there, in which neurobiological issues and very short intravaginal ejaculatory latency time is not very short. Throughout life, person is unhappy, partner is unhappy, maybe pregnancies also may not happen, is the thing here. Provided proper counseling and medication is done. That's why medical management, Yuktiyopasha Chikitsa is all right. Very short IELT, intravaginal ejaculation latency time, medico-psychological. So both Sattvaja and Yuktiyopasha, Vindi, Dhairya, Atmadivijnanam, so everything. Natural variable P, sometimes all right, sometimes dull, sometimes performance anxiety, depending upon the mood swings. So reassurance. No, yesterday was a bad day for you. You come back. You should be all right. Like that. And ejaculatory dysfunction, in which psychological, always psychotherapy should be the answer. So these patients can be managed well with the Akara Krabad Gutika, Akara Krabad Yavaleha, Akara Krabad Rasayana, Jati Phladi Vati, Madanananda Modaka, etc. various stimulants. So this way, from the cerebral cortex tonic descending stereogenic inhibition takes place, from where sympathetic control over the ejaculation goes, and there is a negative feedback. Bulbospongious muscles is getting dilated. So mechanism of ejaculation has been discussed in the applied physiology. So that's how a pictogram appear, how the deposition of seminal fluid from the ampullary deferens, seminal vessels, prostates into the prostate urethra takes place. The bladder, bladder neck, prostate, urethra, tissues of the corpus spongiosum of the penile region, bulbospongious muscle, external sphincter, seminal vesicles, and vas deferens, from where sperm travel through the vas deferens. So this way, the mechanism has been discussed. Next phase is the expulsion phase. There will be closure of the bladder neck with the rhythmic contraction of the urethra by pelvic and perineal bulbous muscle and intermittent relaxation of the external urethral sphincter. Apanavayu. Pano, Panaga, Shonivasti, Metro, Rubochara, Shukra, Arthwa, Shakr, Garbanish Kriya, Vagbata is 100% right, and we have to monitor this. So causes already fear and performance anxiety, ejaculation stress, and some people will be thinking that if the Shukra Dhatu goes, there will be severe weakness, have to protect it, and various areas should be addressed properly. We have to probably Vasyayana. He explains a lot of Mukadorgandinashaka yogas, Sugandalepas, Gandha Malya, different sadhanas, upayas, because by the cosmetic and different sprays, applications, there will be a severe olfactory stimulation, and a lot of stress also will come down. So we have to educate our patient in that way. Biological issues like prostatic hypertrophies and infections, neurotransmitters, increased level, retrograde ejaculation, as well as testosterone content level is reduced, hypotestosteronemia, hypogonadism, and antihypertensive drugs. Some of the drugs, they damage the nervous system, CNS. Some of the surgical condition, hemiplegia, even hemiplegia patients, they are very bad. So, how to treat mental distraction? During the copulation, the male partner should be told that you try to think something else than the sex. Try to maintain the erection by our medicine, Jatifalajivati, or maintain the erection by another yoga like Shukravallabharasa. So mental distractions. Masturbation before sex, of course, not always encourageable. When I attended the sex medicine workshop, this is usually told by the famous sex therapist, but to the patient, I don't believe it should be a very good answer. Usage of condoms will give compression to the penile area. Some of the local applications leading to anesthetizing property. Lignocaine gels there. We have wonderful Sri Gopala Taila, Sanjeevini Taila, etc. Avoidance of foreplay. So here proper education, how the foreplay should be performed, why it is performed. Because usually male partners will be thinking that my job is over. He will never think about the psychological level, mental level of the female partner. So the education, always education, and trial of the second time is also good. Other few exercise has come into the force like yogasana, especially kukutasana, mayurasana, sukoshna jalavasti, because in constipation and severe flatulence, atmana, atopa, anahad lakshanas, I believe the erectile dysfunction is very, very common. Pelvic floor muscle exercise in the form of yoga, squeeze techniques, and condoms. So this way, the exercise can be told to the patients by pictures and diagrams. And these population of PME, Shukra Meha Adhikara, Mutra Shukra Adhikara, in Mutragata, in Mutra Kuchra Prakarana, in Matavyadi Prakarana, we get all these informations. Also, we do get Shukradhatu involvement in the Kushta Prakarana, Shukradhatu Gata Kushta. We do get the information of the Shukradhatu and Shukradhata Jvara. So, here and there, scattered informations are told. We have to collect together and attend our patient. What problem is really having? Doing the dosha estimation, doshic analysis, and always bringing the confidence level in these areas of erectile dysfunction and premature ejaculation will help the patient. Sometimes patient will say, see doctor, soon after ejaculation there was very severe burning discomfort of the genital organ yesterday. Then we have Chandanadivati, we have Chandanasana. Chandana is Tikta Shita, it is Kashaya. Ruktastvatva Shitat Kashayatvat Lagupakat Chayat Bhavet Tambanam Tatsyat. So by the vasoconstrictory effect, by the constriction of the muscles, our Chandana Kalpa is active. But see which dhatu, which dosha is involved there. Sometimes the neuroendocrine issues and neurological pathways disturbed. We require Kamini Vidravana because of the Khanija Dravya. A lot of stimulation is required. And sometimes the Shariragata Daurgandya causing these conflicts. Yes, one patient, she was unable to express her findings. Why? What happened? No, I can't say, doctor. Okay, do one thing. You take these medicines and next time when you come, please bring me in writing. Let me very secretive or whatever the writing they are given back to you soon after. So she came after a few days telling that Sharira Dhaurgandhya is the main problem, and we start quarreling each other on the bed. And why the night comes. So that is why Ayurveda describes all these different Snana Yogas, Panchasugandhi Dravyas, and if they are extended to a case, a patient, they'll be most happiest people, and they will believe for everything and anything. He is our alone doctor who can help us. So with these deliberations, let me conclude the second session, and let me have the question and answer session just for 15 minutes and have a break later. Lakshmi?
Yes,
How are
sir.
you? Yeah.
I'm good, sir.
Yeah.
So, can we start the question, sir?
Yes. Yes.
First question.
Yes.
How is pheochromocytoma is related to Adhistri Kamata?
We can't say directly pheochromocytoma is versus Atisrigamata, but a particular symptom observed in pheochromocytoma because of the excessive liberation of the adrenal content. All of a sudden, a patient will go for a height of exhibitionism and hugging somebody who is very nearby. And that happened to one of our medical colleagues also. So that way, pheochromocytoma originated symptom can be seen at Srikamata. That is the answer. Thank you.
Thank you, sir. What are the doshas involved in asthenotetrazoospermia?
So, according to my opinion, it is Pitta and Vata. Why means there is abnormality followed by reduction in the count. And Pitta, it has got a definitive role because regarding the influence of Pitta, much is not spoken in the Shastra. But when we go to the endocrine theory, Shukra Dhatvagni, Shukra do contain Shukra Dhatvagni. And Mamsa Dhatvagni, Majja Dhatvagni, from Majja Dhatvagni, further development of the Shukra. So all these theories are there. There is a metabolic environment, and there is Dushti at this level of Pitta and Vayu causing these problems. Thank you.
Thank you, sir. A patient with history of 1 undescent testis, whether it will affect fertility or testosterone production level?
Definitely, there are chances because what happened when I stepped into practice, one boy had a torsion of testis, and for the torsion, that time only surgical intervention was the only remedy. He underwent surgery. When he grown up, he had a testosterone content deficiency. He had a severe oligospermia. Of course, now he had come for treatment, etc. Because he is very close to my family that way. The same way, undescended testis too. If one is already in the England canon and one is descended, there are chances of getting imbalance. But however, we can help them for the fertility by the aspiration method or by giving our medicines as well as Gulmavat, the Vruddhamat Chikitsa should be incorporated in the beginning, followed by a continuous administration of Karmavasti or Yapanavasti Vidana, Mamsarasa Siddhavasti may be useful to them. Thank you.
Thank you, sir. Hope that doubt was clear. Next question. Patient of 29 years having phimosis doesn't have any difficulty during ejaculation or coitus. Does it cause any difficulty for conception?
No problem at all. So entirely it's a very safe method because the phimosis surgery or the paraphimous surgery what the patients used to undergo is for their urethral incontinence and urethral stricture and other maturation problems. So usually during the childhood only patients will undergo this, and for the if the semen parameters are normal, there is no problem for conception. Thank you.
Thank you, sir. What are the indications for Shukra Rechaka, Shukra Pravartaka, and Shukra Stambhaka Dravyas? What are the differences observed?
Yeah, Shukra Stambhaka Dravyas in conditions like premature ejaculation, Shukra Meha, and so on, different issues. Shukra Stambhaka Dravyas once again in erectile dysfunction. There, whether you have to go for Tikta Kashaya Shita Dravya, depending upon dosha, or Ushta Tikshna Dravya and Uttejaka Dravya, that you have to think of. Second thing, Shukra Rechaka, especially in retrograde ejaculation, as well in anejaculatory copulation, as well Shukra Rechaka in the sense low volume semen. There it is very useful. Shukra Dhatu Kshaya, that is Pramanata Kshaya. Shukra, what is another point here? Shukra Rechaka, Shukra Stambhaka. Hello?
Sir, Shukra Pravartaka.
Shukra Pravartaka. Here, Pravartaka in the sense from the tunica albuginia, the maturation and motility. So, there comes mainly the prayoga of the Kapikachu like drugs. So, that means the motility rate is increased. Kapikachu, that's why in the practice, Markati Mula Prayoga, Markati Mula and Markati Phala Prayoga, Markati Bija. Markati Mula, I observed, is very, very useful in vaginismus because if the partner is not happy, if the partner is developing some pain during copulation, then Markati Mula Kshirapaka is found to be very effective. That way, Kapikachu Bija is Pravartakan Janaka. As well, Markati Mula is also very useful in female population. Thank you.
Thank you, sir. What is the concept of morning erection? Both aspect, Ayurveda and modern.
So the modern explanation is very simple. Once after the bladder is full, naturally the prostate glands are stimulated and the chromatic muscles are elevated up, and there will be a lot of blood flow into the penile organ. There will be erection without knowledge. Whereas regarding Ayurveda, much information are missing, but still we can say from the Nidra to the Jagaruk Avastha when it comes, so penile erection is possible. And so from the sleeping posture to the Pranamata Uttejana or the Pranamata stimulation, because there is a role of all the Panchavatas in the maintenance of erection, in the production of spermatozoa, Shukra Dhatu. So there comes one by one Pranavata, Udana, then the Apana, Vyana. They're all getting one by one responded. So ejaculation, ultimately with Apana, is happening. Thank you.
Thank you, sir. Is there any chance of infertility due to one-sided epididymal cystectomy?
Usually there is a possibility again because Usually, both testicles act in a synchronized manner. When there is an imbalance, there is a possibility of getting a reduction in the sperm concentration, motility, etc. But of course, we can overcome this situation by the prayog of Kanija Dravya, by the prayog of Sacharadi, Kshirabasti, etc. Thank you.
Thank you, sir. Hope that doubt was cleared. Is there any reference of gynecomastia and its treatment?
Directly in the Shastra, though there is no much statements regarding these components, as explained before, Ashtau Ninditya, one has to read the Ashtau Ninditya at length. Each and every word critically we have to review, analyze. Then every commentary on Charaka we have to discuss. Then we have to go to further the Yoniya Prakarana. Further come back to the Prakarana of Sushruta Sharira, where these Klaipi Prakarana and Shanda Prakaranas are told. Then we get the informations there. And one of my colleagues, he was widely using the Vidari Kanda in oligospermia. He observed oligospermia even that stimulate the prolactin content. And gradually, prolactin level of the patient was increasing. In the sense, whether he may landed up with gynecomastia, the question comes. So research will give answer for these areas. Thank you.
Thank you, sir. How to treat tetrazoospermia through Ahara Vidhi?
Yes, definitely. It is not only Ahara Vidhi, it is Pravicharana Sneha here. Odanaschavilepi cha raso mamsot payodadi yavago supasakascha yushak kambalika kadaha. That way, Rishya Aharas Bhojana should be entertained. Bhuktva Snatva Payam Pitva Rasanushaina. So Mamsarasa Prayoga and Prayoga of Kukuta Mamsa, Tamra Chuda Mamsaha, Prishyanam Shishtaha. Then Vastanda in the form of Ahara should be encouraged. Also, amongst the vegetable origin, it is Gozuma, Puranashali, and Draksha, like different drugs should be given in the Ahara. As a part of Vicharana Sneha, Sneha Dravya should be encouraged, especially Thailand, Grita or Amakas. Thank you.
Thank you, sir. How can we differentiate azoospermia is asadya or sadya? What test can we check?
Yes. Azoospermia really a great problem. What happens? The gynecologist or infertility specialist say that, and they will tell the patient no, nothing is possible. But when they come to us, a careful history should be taken. And since how many days this? Whether any previous reports are showing minimal amount of spermatozoa is present, and aspiration in few patients, what we have been doing aspiration test, and when it is in the ejaculum, in the seminiferous fluid, spermatozoa is absent. In the aspiration, it is present. So then what that means? So there is a genesis, definitely. But that is not properly reaching to the duct. At that level, there is some problem. And if that is the case, we can encourage it definitely. Whereas total azoospermia with the hypogonadism, total azoospermia with the endocrine issues, very difficult. If it is progressive one, we can help the patient like anything. Thank you.
Thank you, sir. That was the last question.
Yeah.
I hereby inform the participants that we are taking a break and will resume the class at 7 p.m.
Okay. Yeah. Thank you, Lakshmi. I'll take a break and after 45 minutes, we'll be coming back. Okay.
Sure, sir. Thank you, sir.
Hang on.